Welcome back to Insight. I'm here with Todd at Indiana Physical Therapy. We're talking about dry needling. It's trigger point dry needling, right?
Yes, trigger point dry needling.
So tell me what it is.
Yeah. So trigger point dry needling, we use a very thin, solid filament needle. It's the same needles they use in acupuncture, but a different application of it. And what we're doing is finding knots within the muscle, and we're going to use that needle to get in there and try and loosen up those knots. So that can help relieve pain, improve some mobility, some of those things that might be a component of a condition that somebody's coming in for in therapy.
Well, I was going to ask you what somebody should expect, and instead I'm going to kind of show somebody what they can expect, because there's a reason that my jacket is pulled up here. We're going to try it, and you may find a knot in my arm because, well, they're all over my body. I'm kind of a train wreck. So show somebody what happens when they come in for trigger point dry needling.
Certainly. So first of all, we're going to do a full evaluation. So if somebody was coming in with elbow pain, we might look through the whole body. We might see how the neck moves, see if that's affecting the pain. So lots of different structures could be referring that. In that process, we might find that there are some trigger points and issues in the muscle that are leading to part of the pain. And so then somebody might benefit from dry needling. So we're going to do in that point, we're practicing clean techniques. So we're going to clean our hands, we're going to clean the skin, and then we're going to we've got you positioned already, but we're going to choose a position where we can safely get to that trigger point, and then we'll work on needling it. So we're just going to clean that area real quick.
Forget any lotion I had on my arm today.
Yep, you'll have to re-lotion later. We definitely don't want that lotion to be going into the skin.
And these are, for somebody who can't tell, these are really thin needles. I mean,
they're very thin. And most of the time, you don't actually feel the needle itself going in. So when we get into a knot, you might feel some achy, crampy sensations. Occasionally we'll get a little bit of a twitch of the muscle, and so that can feel a little bit startling at first. But generally, the actual needling is not that uncomfortable. Okay. So we're just going to come in here, we're going to find that muscle, and we're going to be searching through there to try and kind of find some knots in it. And from that point, we're just going to insert the needle, and it's just a quick, and so oftentimes you don't really even feel
honestly,
much with that.
I don't feel a thing.
Yeah. So there we got a little bit of a twitch of the muscle.
I felt that, but it didn't hurt. Oh, I can just feel it moving.
Yeah.
That's so weird.
Yeah. So we're just kind of moving that needle in and out a little bit through there.
So what type of issues respond to dry needling?
And once we get all those twitches out, we're out. You know, a lot of times what we'll see are some chronic conditions. So overuse of a muscle can oftentimes cause some trigger points to develop. Sometimes an acute, I see a lot of runners and athletes where they've just overused a muscle a lot and got some trigger points and knots in there that just aren't responding to other things. And so trigger point dry needling can help. Or just some chronic conditions that have been going on for a long time and haven't responded to a lot of other interventions can sometimes respond well to dry needling.
Can somebody do activity after dry needling?
Yeah, there's really nothing we need to avoid. The activities that have caused the pain, we might still limit those just as we would in any circumstance, but we really don't need to change our activities through the day just because we had dry needling in our PT session.
It's fascinating. It's absolutely fascinating. If you have some chronic pain, you should try this dry needling. I'm telling you, you don't even feel it. And that muscle twitching thing, that's kind of cool. So give the central scheduling number a call today. It's 260-209-2464. Check them out online, indianapt.com. We'll be right back.